He says actor Charlie Sheen inspired him to write his latest book, the title Sex, Lies, and STDs.
With the CDC's recent reports of STDs on the rise, it couldn't be a better time to tackle this topic. Dr. Robert Huizenga joins us now. Dr. H, as he's known from The Biggest Loser, of course, with the LA Raiders. Lots of things you've done, Dr. H. Thanks so much for coming in to talk about your latest book.
Appreciate being here, because this is a major public health crisis. You know,
Right.
The CDC just released yesterday that we're going backward. We have an epidemic, 80% more gonorrhea, 80% more syphilis than just 4 years ago. It's insane. How could this happen?
Yeah, what do you attribute this to? Like, why is this happening?
Well, it's a confluence of different factors. We've got online dating. We've got the cure, or the treatment, no cure, of HIV makes people use condoms less. And we've just got more casual sex. And we've got a breakdown of our infrastructure for STD control for public health.
These apps that are out there, you touched on it briefly, is that leading to some of this?
Well, unfortunately it is, because we know STDs are in part related to the number of sexual contacts. And, you know, we used to track down STDs, and now it's difficult because people have relations and they don't even know where their partner lives or what their last name is.
Wow.
That's scary. Now, we're talking about that aspect, but I understand there are also STDs that you can get without actually having sexual encounters.
Well, sure. People don't recognize that sometimes we, know sex education. People think, well, if I use I hate to say this, but the Bill Clinton definition of sex, if I have oral sex, I can't get, nothing could be further from the truth, because many STDs, and we have an epidemic now of genital herpes type 1 because of oral intercourse. So we need education.
We know you're an expert in weight loss. Obviously, your book titled Sex, Lies, and STDs. Little help from Charlie Sheen on this one, a little inspiration behind that. And I don't even have to ask you why.
Well, we both went together on Good Morning America, and he said, hey, I have HIV, and he was honest to the American public.
Right.
And it shocked me that there was this outpouring of, he's got a loaded gun in his shorts, he's going to kill all these women. And they were accusing me of being an enabler doctor because he admitted on camera that he had had intercourse with several women without a condom, which started the whole book. And I'll ask you, Nichelle, what's riskiest in terms of getting HIV for a woman? Having sex with an individual that's treated with HIV, or going to the hottest nightclub in San Diego and having sex with the hottest guy with a condom? What's the riskiest thing for you as a woman?
All of the above? I mean...
It turns out that with the new anti-HIV cocktails, the chance that they give fully treated HIV is essentially zero. And even assuming the worst case scenario, condoms only work 80% of the time with HIV. They fall off, they break, they're used improperly. There are hundreds of thousands of individuals that don't know they have HIV. And so that makes the risk of just having a one-night stand with someone you don't know 100-fold higher than having sex without a condom with an HIV-positive individual. And people have no idea about that.
It's scary, and I do want to ask you, you say that there's a lot of misinformation that is out there, whether it's coming from people in the medical profession to begin with or just publications out there. What was the biggest piece while you were gathering this book? Because we were talking about it. You've been an expert at a lot of things as far as in the weight loss world. What did you find that shocked you?
Well, the number one thing that shocked me is you can't understand STDs from the internet. I'm a doctor from Harvard. I tried to research stuff and it was impossible. That's the first thing. Number two is I have always assumed, hey, if you have an STD, you have symptoms. Spoiler alert, the number one presentation of STDs is no symptoms.
Really?
So you need a regular checkup. This has to be part of your routine care, especially if you have multiple partners. And people have no idea what they should do as routine care, and they don't even know if they're at high risk.
So what should you be asking your doctor?
Yeah.
You should be asking your doctors. Doctors are so busy, they don't even ask about, are you at high risk? Do you have multiple partners? Are you a man who has sex with men? Are you an individual that uses drugs with intercourse and increases your risk? Are you someone that is employed in some kind of transsexual sex worker system? And if you are, your risk, you probably need STD checks 2 or 3 or 4 times a year.
We should probably end on sexually active people using condoms can really help prevent these numbers that we've been seeing from 2017, correct?
Condoms are huge, but they also need to know about vaccines, and they need to know about medication taken before intercourse that can markedly lower the risk of STDs.
Okay, we should also let people know, where can they get your book?
It's on an ebook on Amazon.com.
All right. Wow.
You've enlightened us a lot this morning, and
Yeah.
a lot
Thank
of
you so much.
information too that we could go through, but
a
unfortunately
huge
we are
problem.
out of
Yeah.
Absolutely. Thank you so much for your time this morning. Great
Thanks for
chatting
having
with you.
me.
Appreciate it.
Very good.